Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to treat or fix frozen shoulder naturally. I will go over the 3 powerful treatments that overlooked by a lot of healthcare providers that actually treat the root cause of frozen shoulder and resolve it quickly. Before I go over the treatment, it's extremely important to understand what is frozen shoulder and normal healing cycle. So it will make sense how to treat the root cause of frozen shoulder or adhesive capsulitis. So as you see in this image, frozen shoulder, it's usually the technical term for it is adhesive capsulitis, which indicative of inflammation and thickening of the capsule that attach the humerus head to the scapula. So when that happens, it's like you're wearing a t-shirt 2 to 3 size too small, so it prevents your range of motion and you will not be able to move your shoulder. So when you look at this model here, so you have the humerus head here and you have the scapula here, and this is the capsule that attach the humerus head, the humerus to the scapula. So when you have frozen shoulder, you start to have inflammation in this capsule, you start to have thickening in this capsule, so it prevents the humerus head from moving, and that is the main cause or issue for frozen shoulder. So our body has to go through 3 stages in order to heal. I'm gonna use external paper cut here for visualization, but the same thing happens internally when you have adhesive capsulitis or frozen shoulder, but we don't see it because it's covered with the skin. So the first stage of healing is inflammation. As you see here, swelling, redness, and the blood start to rush to that area. And it's the same thing happened to frozen shoulder. You start to have inflammation, swelling, and that could cause by injury, vitamins, hormonal imbalance, and other causes. I cover it in other videos. Second stage of healing is actually called the proliferation stage, and when you look at this second image, you will see scarring, fibrotic tissue, and by definition is actually frozen shoulder is thickening fibrotic tissue in the capsule. So you start to have fibrotic tissue, fascia restrictions, muscle spasm, trigger points. In perfect scenario, during the maturation stage, and that's the last stage of healing, the body should get rid of inflammation from the first stage and anything that in the second stage like fibrotic tissue, fascial restriction, and muscle spasm, and everything clears up. But when you have frozen shoulder, this is not the case. If that's the case, it's resolved. But frozen shoulder, it's a very complex condition that actually your body going back and forth between inflammation and proliferation stage, and by definition it's inflammation and fibrotic tissue. As you see in this image, normal capsule should be nice and smooth like this, it's not swelled up, and when we look at the adhesive capsulitis, you start to have inflammation and thickening that prevent the humerus head or the humerus bone to move in relationship to the scapula. So how to treat frozen shoulder? We have to address the normal healing cycle because that's the root cause of the problem. But before I do that, I'm gonna go over some ineffective treatments so you don't have to waste your time and money on it, that very commonly used in clinical setting. I will relate that to the normal healing cycle so it will make sense why this treatment is not treating the root cause of the problem. So for example, heat and ice and steam, based on a study, it provide temporary pain relief, but there is no long-term studies proving that it's effective treatment, and I will leave link for those studies that shows these are ineffective treatment to treating the root cause of the musculoskeletal problem. So when we look at heat or ice temporarily decreases inflammation but does not provide a long-term result for inflammation, does not do anything to the proliferation stage. The same thing with foam roller or massage. You massaging inflamed tissue, you're actually going to inflame it more. And massage and foam roller not targeting fibrotic tissue, not targeting fascia restriction. So it's not treating the root cause of the problem. Acupuncture, dry needling, the same thing. It will not decrease the inflammation. It will not break the adhesion and the adhesive capsulitis. So it's not treating the root cause of the problem. The same thing, joint mobilization, moving the joint. It's not going to break the adhesion. We have to target the adhesion tissue, and also we have to target the fibrotic tissue to release it. So the other thing is stretching and strengthening exercises. So it does not make a lot of sense to start to strengthen muscle that the problem is actually in the joint that is not related to muscle weaknesses. So we have to address the adhesive capsulitis, releasing the adhesion, and then strength exercises will be effective. Stretches is actually, based on the studies, cause more inflammation. I personally do not recommend it to my patient because actually could make it worse. Strength exercises has to be introduced, but not in acute stage or in chronic stage that there is a lot of inflammation, a lot of fibrotic tissue. We have to address that before even strengthening the muscles. So the main question is how to treat the root cause of frozen shoulder. And it's very simple. When we look at the normal healing cycle, it makes a lot of sense that we have to decrease the inflammation. We have to break that vicious cycle of proliferation inflammation stage. So the first thing I do with my patient is decreasing inflammation. So the most effective approach for inflammation, this is not going to work. The rest, for frozen shoulder, it's not going to work. We have to do aggressive approach to decrease inflammation because these patient has severe internal inflammation. So what I personally do, I give my patient MagnaHeal 2 to decrease internal inflammation. So this magnet, the range of it like 3 to 4 inches that penetrate the body. So we have to locally decrease the inflammation. That's not enough by itself. We have to internally decrease the inflammation in relation to vitamins, mineral imbalance. This is extremely overlooked by a lot of healthcare provider, and I see it frequently in the clinical setting that healthcare provider do not think that there is vitamins mineral deficiency that slow down the healing cycle. And if we don't do that simultaneously with using the magnet by itself is not enough, because I see it very frequently that those patients that has frozen shoulder, they usually have vitamin mineral deficiency. And if you don't have proper nutrition evaluation, you're not gonna know which vitamins or mineral has deficiency that interfere with your normal healing cycle. For example, you need to have B, C, magnesium, zinc, D for your body to move from inflammation stage to proliferation stage to maturation stage. And if your healthcare provider do not evaluate you properly to figure out what vitamins and minerals or even hormonal imbalance that slow down the healing or make you stuck in this vicious cycle, the treatment will not be effective. And I see it frequently on my patient. They have frozen shoulder for years and they still have frozen shoulder. And when I start to evaluate them, they have not received proper evaluation to resolve the problem. So to decrease inflammation, we have to locally decrease the external inflammation by using the MagnaHeal 2. At the same time, proper evaluation for vitamins and mineral deficiency, and I have to put those patients on anti-inflammatory diet. There is a lot of food that cause internal inflammation in the body, so I'm making sure that patient do not eat the inflammatory food that slow down their healing and increase localized inflammation. So the most effective approach to decrease localized inflammation or inflammation in relationship to frozen shoulder using the MagnaHeal anti-inflammatory diet restore deficiency, and that's require proper medical evaluation. The second thing we have to work on in this vicious cycle is the proliferation stage, and by definition is a frozen shoulder adhesive. Adhesive capsulitis is fibrotic tissue in the capsule of the shoulder. So we have to break the fibrotic tissue, and that's why I said massage foam roller is not going to work. It's not going to go deep enough. It's not going to be targeting enough to break the fibrotic tissue. So I want you to look at this image. When you have normal muscle, it look like nice and smooth like this first image here. When you start to have micro tear or tear in the muscle, you start it to look like this. Fibrotic tissue, it look like this, very random fibrotic tissue that look like actually disgusting like this. That's internally. When you have fibrotic tissue or adhesive capsulitis, you will see the unevenness, that excessive tissue there. Actually, fibrotic tissue is very essential for our survival. When you have a tear, when you have an accident, the body builds the fibrotic tissue to glue those tissue together. The problem is when you have too much of that glue that interfere with the range of motion, because our muscle should act like a rubber band when you contract and relax, stretch like this. So when you have fibrotic tissue, it's like you have a knot in a rubber band. So when your muscle contract, will not stretch much. That's going to limit the range of motion, and that's what limit also the range of motion in your capsule and your shoulder joint. So how to break that fibrotic tissue? What I personally do is I use the A3 to break superficial fibrotic tissue in the shoulder joint and the muscle around the shoulder. And then I use the A5 to go deep enough to break the capsule adhesion fibrotic tissue. So simultaneously, while I'm working on decreasing inflammation, I have to break the fibrotic tissue to loosen up the shoulder capsule so patient will be able to gain range of motion. The third treatment that's extremely overlooked by a lot of health care providers are the fascia restrictions. And I will show you the fascia system and why it's very important to address it, because if it's not addressed properly, the treatment will not be effective. And that's those the patient I see them have frozen shoulder 3 months, 6 months, or even years, because the provider did not treat the root cause of the problem. They just focus on stretching and exercises. Stretching and exercises will not gonna increase range of motion in the capsule itself. We have to work on the capsule. Stretch and strength, that's for muscle. To stretch or strengthen the muscle, which does not make any sense from logical perspective, to strengthen the muscle to address the capsule. That's totally different, two different issue. Think about this way. Someone has blood pressure issue and they go to the healthcare provider and they give them diabetic medication. It's not make sense. And that's exactly what happened with a lot of frozen shoulder patients. They go to physical therapists and they keep doing strengthening and stretching exercises, which working on something different than the capsule. So they're not getting better. So the fascia system, to make things complicated, but don't worry, the treatment very simple. Next time when you go buy meat, look at the white filament. That is the fascia system. So when we dissect a cadaver, you see the white filament, that's the fascia system. So to make it complicated, but don't worry, the treatment very simple. The fascia system divided to two major groups. The superficial fascia wrapping the entire body, it's like a Spider-Man suit, and you have the deep fascia that divided to 4 subcategories: apparatic fascia, epimysin, premiysin, and endomysin. And each of these layers is actually have 1 to 2 layers on the top of each other. So when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small, so it will prevent the range of motion. That's why it's extremely important when we work on adhesive capsulitis, because to address the fascia restriction, because the fibrotic tissue is actually gonna glue those fascia layers together and prevent them from being loose to allow you to have full range of motion. So when you have your fascias like a Spider-Man suit or that t-shirt that's very tight, that of course will limit your range of motion. So simultaneously, while we're working on releasing the fibrotic tissue, the inflammation, we have to release the fascia system. And as you see it here, it's a very complex system, but the treatment very simple. What I personally do is I use the A1 to release superficial and apparatic fascia, and I use the A5 to release the epimysin, premiysin, and endomysin. So to really treat the root cause of frozen shoulder, we have to simultaneously decrease the inflammation, working on a proliferation stage by breaking adhesion from fibrotic tissue and decreasing fascia restriction. And that's basically treating the root cause of frozen shoulder. If you have any question or comment, leave it in the comment section below and I will answer it in a future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.